Hi everyone, welcome back to the channel. Good to see you again. If you catch every cold that goes around, if cuts and scrapes take forever to heal, if your hair is thinning and you can't figure out why, if your sense of taste isn't what it used to be, stop right there. What I'm about to share could change everything. There's a mineral that affects over 300 enzyme systems in your body. 300. It controls your immune system, heals your wounds, builds your DNA, affects your hormones, protects your brain. Without enough of it, your body literally can't function properly. And here's the shocking part: nearly 2 billion people worldwide are deficient in this mineral. 2 billion. That's 1 in 4 people walking around with low levels right now. Most doctors never test for it. Most people have no idea they're deficient until serious problems develop. Your immune system weakens. Your wounds heal slower. Your hair falls out. Your testosterone drops. Your sense of taste disappears. All because of one missing mineral. Clinical studies show deficiency increases your risk of pneumonia, diarrheal diseases, and complications during pregnancy. Research confirms that approximately 17% of the world's population faces zinc deficiency. In some developing countries, that number jumps to 72%. Even in the United States, studies found that about 8% of males and females have levels below what's considered sufficient. Right now, you might be experiencing symptoms and blaming age, stress, or bad luck when the real problem is simpler than you think. Today, we're talking about zinc, the mineral your body desperately needs, but probably isn't getting enough of. Quick reminder before we continue. This video is educational. Always consult your doctor about supplements, especially if you take medications or have health conditions. I'm providing information to help you have better conversations with your healthcare provider, not to replace medical advice. Your doctor knows your complete history and can guide you properly. Now, let's talk about why zinc matters so much and how to know if you need more. Zinc is the second most abundant trace mineral in your body after iron. Every single cell needs it. Your immune cells, your brain cells, your skin cells, your reproductive organs. Everything. Think of zinc like oil in a car engine. Without enough oil, parts grind against each other, wear down faster, eventually fail completely. Without enough zinc, your body's systems start breaking down. Here's what zinc actually does. It activates over 300 enzymes. Enzymes are proteins that make chemical reactions happen in your body. Without zinc, these reactions slow down or stop completely. Your immune system can't respond to threats. Your cells can't divide and grow. Your DNA can't replicate properly. Your wounds can't heal. Zinc also stabilizes cell membranes and protects against oxidative stress. It helps insulin work properly. It supports normal growth and development during pregnancy, childhood, and adolescence. Men need zinc to produce testosterone and healthy sperm. Women need it for reproductive health. Everyone needs it to maintain their sense of taste and smell. Medical research shows your body doesn't store zinc long-term. You need to consume it regularly through food or supplements. If you don't get enough daily, levels drop fast. Symptoms can appear within weeks of inadequate intake. First, immune system function. This is zinc's most powerful role. Your immune cells absolutely depend on zinc to function. Clinical studies demonstrate zinc deficiency impairs immune response so severely that even mild deficiency increases infection risk. Zinc helps your body produce and activate T cells, the white blood cells that fight infections. Without adequate zinc, your T cells don't develop properly and can't attack viruses and bacteria effectively. Research shows zinc supplementation can reduce the duration of common colds by approximately 33% when taken within 24 hours of symptoms starting. Studies found zinc lozenges shortened cold duration from 7 days to 4 days on average. That's measurable, significant improvement. Zinc also reduces the severity of symptoms while you're sick. For respiratory infections, zinc creates a protective effect. Data shows adequate zinc levels reduce pneumonia risk in children by up to 41%. In elderly adults, zinc supplementation decreased infection rates and improved vaccine response. This isn't magic. Zinc directly affects how well your immune system detects threats and responds to them. People with chronic low zinc have weaker immune systems, period. Second, wound healing. Zinc is essential for skin integrity and tissue repair. When you get cut, scraped, burned, or have surgery, your body needs zinc to heal properly. Research confirms zinc deficiency slows wound healing significantly. Zinc is required for collagen synthesis, cell division, and inflammatory response. Without it, wounds stay open longer, infection risk increases, scars form pearly. Studies show zinc supplementation accelerates healing in people with leg ulcers, surgical wounds, and burns. Talk to your doctor before using zinc for wound healing, especially if you're taking other medications. Third, testosterone and male reproductive health. For men, zinc is concentrated heavily in reproductive tissues and seminal fluid. Studies have found clear links between zinc levels and testosterone production. Research involving young men showed that dietary zinc restriction caused testosterone levels to drop significantly after 20 weeks. Baseline testosterone averaged 39.9 nanomoles per liter, dropping to just 10.6 nanomoles per liter with zinc restriction. In elderly men with marginal zinc deficiency, supplementation for 6 months increased testosterone from 8.3 nanomoles per liter to 16.0 nanomoles per liter. That's nearly doubling testosterone levels just by correcting zinc deficiency. Zinc also affects sperm quality, motility, and count. Studies show low zinc is associated with reduced sperm parameters. Improving zinc intake in deficient men can improve fertility markers. Talk to your healthcare provider before supplementing zinc for testosterone or fertility concerns. Zinc doesn't boost testosterone in men who already have adequate levels. It restores normal levels when deficiency exists. Fourth, skin health. Zinc plays multiple roles in skin function. It supports skin barrier integrity, reduces inflammation, fights acne-causing bacteria, and promotes healing. Studies show zinc supplementation helps reduce acne severity. Zinc's anti-inflammatory properties make it effective for conditions like acne, rosacea, and dermatitis. Zinc oxide is commonly used in topical creams for diaper rash, sunburn protection, and skin irritation. The mineral helps protect skin from UV damage and supports repair of damaged tissue. Fifth, brain function and mental health. Zinc is essential for neurotransmitter function and brain signaling. Research links zinc deficiency to depression, cognitive dysfunction, and behavioral abnormalities. Studies show zinc supplementation may improve symptoms of ADHD and depression in people with low zinc levels. Low plasma zinc has been associated with psychological disorders, including schizophrenia. Cognitive functions like learning, memory, and mood regulation depend on adequate zinc. Deficiency in children can cause behavioral issues, poor concentration, and impaired intellectual performance. Sixth, growth and development. Zinc is absolutely critical during pregnancy, infancy, childhood, and adolescence. The body needs zinc for cell division, DNA synthesis, and protein production. All of these are essential for growth. Research shows zinc deficiency causes stunted growth in children. Studies estimate that zinc deficiency contributes to growth failure in 1/3 of the world's population in low-income countries. Pregnant women need adequate zinc for proper fetal development. Deficiency during pregnancy increases risk of premature birth, low birth weight, and complications. The recommended daily allowance varies by age and sex. For adult men, it's 11 milligrams per day. For adult women, it's 8 milligrams per day. Pregnant women need 11 milligrams, and breastfeeding women need 12 milligrams. Children's needs range from 2 to 11 milligrams depending on age. Your body absorbs zinc better from animal-based foods than plant-based foods. Oysters contain the highest zinc of any food. 6 medium oysters provide approximately 32 milligrams of zinc. That's 291% of the daily value for men and 400% for women. Other excellent sources include beef, with a 3-ounce serving providing about 4.8 milligrams. Crab offers about 6.5 milligrams per serving. Chicken, especially dark meat, provides 1.5 to 2 milligrams per 3-ounce serving. Plant-based sources include pumpkin seeds, cashews, almonds, chickpeas, lentils, and fortified cereals. However, these contain phytates, which bind zinc and reduce absorption. Vegetarians and vegans may need higher intake to compensate for lower bioavailability. Dairy products like cheese and milk provide zinc that's highly bioavailable. Eggs contribute small amounts. Watch for these warning signs. Frequent infections or colds that last longer than normal. Slow wound healing. Cuts and scrapes that take weeks instead of days. Hair loss or thinning, especially if unexplained. Loss of appetite. Changes in taste or smell. Food doesn't taste right, or you can't smell things as well. In men, low testosterone symptoms like reduced muscle mass, decreased libido, erectile dysfunction. Skin problems including acne, rashes, or lesions. Diarrhea. In children, delayed growth and development. If you notice multiple symptoms, talk to your doctor about testing zinc levels. Vegetarians and vegans face higher risk due to phytates in plant foods blocking absorption. People with digestive disorders like Crohn's disease, ulcerative colitis, or celiac disease absorb less zinc. Those who've had weight loss surgery. People with alcohol use disorder. Pregnant and breastfeeding women have increased needs. Elderly adults often have inadequate intake and reduced absorption. People taking certain medications long-term, especially thiazide diuretics for blood pressure. Most people can get enough zinc from a balanced diet that includes animal foods or diverse plant sources. Supplements become necessary when diet alone can't meet needs or when deficiency exists. Common supplement forms include zinc gluconate, zinc citrate, zinc picolinate, and zinc sulfate. What matters most is the elemental zinc content listed on the label. For most adults, 8 to 11 milligrams daily is sufficient. Some people may need higher doses temporarily under medical supervision. Always take zinc with food to prevent nausea. If you take iron or calcium supplements, separate them from zinc by at least 2 hours to avoid absorption interference. Consult your healthcare provider before starting zinc supplements, especially if you take antibiotics or other medications. Zinc can interact with quinolone and tetracycline antibiotics, penicillamine, and some blood pressure medications. This is extremely important. More is not better with zinc. Exceeding safe limits causes serious problems. The tolerable upper limit is 40 milligrams per day for adults. Going above this, especially long-term, creates real health risks. Acute zinc toxicity from very high doses causes nausea, vomiting, abdominal pain, diarrhea, and headaches. In severe cases, gastrointestinal bleeding can occur. The most serious long-term danger is copper deficiency. Zinc and copper compete for absorption in your gut. High zinc intake blocks copper absorption. Over time, this depletes your body's copper stores. Copper deficiency causes anemia that doesn't respond to iron supplements. It causes neutropenia, meaning dangerously low white blood cell counts that leave you vulnerable to infections. It can cause neurological problems including numbness, weakness in arms and legs, difficulty walking, and nerve damage. Studies document cases where people took excessive zinc, sometimes just 50 to 65 milligrams daily for several months, and developed severe copper deficiency with life-threatening anemia and neutropenia. Some required hospitalization and blood transfusions. The neurological damage from copper deficiency can be permanent even after stopping zinc and taking copper supplements. High zinc intake also lowers HDL cholesterol, the good cholesterol that protects your heart. It can impair immune function despite zinc's role in immunity. Never exceed 40 milligrams daily unless your doctor specifically prescribes higher doses for medical reasons and monitors you closely. If you take zinc supplements, monitor for symptoms of copper deficiency and discuss copper testing with your doctor. Zinc is essential for immune function, wound healing, testosterone production, skin health, brain function, and growth. It activates over 300 enzymes. Your body needs it daily because it doesn't store zinc long-term. Nearly 2 billion people worldwide have inadequate zinc intake. Deficiency weakens your immune system, slows healing, causes hair loss, reduces testosterone, impairs taste and smell. Best food sources include oysters, beef, crab, chicken, pumpkin seeds, cashews, and fortified cereals. Men need 11 milligrams daily. Women need 8 milligrams, with increased needs during pregnancy and breastfeeding. Supplementation helps when diet is inadequate or deficiency exists, but never exceed 40 milligrams daily. Too much zinc causes copper deficiency with serious consequences, including anemia, low white blood cells, and nerve damage. If you suspect zinc deficiency, talk to your doctor about testing. Work with your healthcare provider to determine appropriate intake through food or supplements based on your individual needs. Share this video with someone who's always getting sick or whose wounds heal slowly. They might have low zinc and not realize it. Comment below. Do you take zinc supplements? Have you noticed any changes your experience helps others? Subscribe and turn on notifications for more evidence-based health information. No hype, just research and practical information you can use. Thank you for watching. Stay healthy. Stay informed. God bless.